77 WABC, New York.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, it's Gil Lederman. Good morning, everybody. We hope you had a good evening and ready for a beautiful day. I'm here with John Taransky, who's my co-host.
Good morning, Dr. Lederman. How are you?
How are you?
I'm doing well.
And we welcome Coop back to the show after a week. I don't know, he was in Hawaii or something last week. He's back running the controls, and he's taking your call. And Erin is there taking your calls, and she's sitting at the switchboard, lonely, waiting for your calls. So please don't leave Erin lonely. Call her at 1-800-848-9222 if you have questions, concerns, or want to talk about cancer news or how to make your cancer life better. The week was dominated by Obama, so we're not political people here, but Obamacare is coming to the forefront, and it's a little bit like getting divorced. You find out what marriage is about. Now they're trying to implement Obamacare, and we're finding out what it's about.
Right, exactly, yes.
And
it's a very big issue, Doc.
It turned out that I think only 6 people or 12 people enrolled on the first day. It was quite a fiasco, and the computers are still not functioning. And people are seeing that it's social engineering,
right? And
you can like it. I have friends who like it, who think it's the greatest thing since
sliced bread,
something like that. That cliche. And there's other people who think that the young shouldn't be subsidizing others, that the healthy shouldn't be subsidizing the sick, and that everyone's paying more with this social engineering.
Right.
And I guess the most famous thing that came out this week was a negation of what President Obama had told the people, that if you have your insurance and you like it, you keep it.
Right.
And if you have your doctor, you like him or her, you keep them.
Sure.
And now it turns out, well, almost.
There's always under the fine line, yes.
And now he's saying if you like your insurance and it's substandard, then it doesn't meet my criteria. So it's a little bit worrisome, and actually the approval ratings of Obama went down to the lowest level, I think, in his presidency.
Wow.
So a lot of people are concerned that maybe what we were told was not exactly the case. And apparently there's documents out there from 2009, 2010, knowing that many, many people would be losing their insurance. And apparently millions of people are losing their insurance or getting notices for higher premium.
Yeah.
So anyway, that's social engineering, and we're not a political show, but that was kind of like the forefront of medical news this week. There's a lot of interesting patients that I want to talk about, and each patient I talk about has a lesson, and we always learn from our experiences, or we hope to learn from our experiences to make us better and smarter and to educate each one of us about what our bodies can do to us and how we can be smarter if we have friends or loved ones or ourselves that, God forbid, these things happen to. So we had several interesting cases. One was a man who flew in from St. Petersburg, Russia. So a 30-year-old man who for the last 8 years has had episodes of seizures, periods when he has difficulty speaking, and hand weakness on the right side. So it suggests something on the left side of the brain. The left side of the brain is the dominant hemisphere. That's where most of our speech and thought comes from. And in fact, in 2008, he had a scan of his brain which showed a large mass in the brain. He was able to get a non-contrast, which means a scan without injection of dye, and it suggested a large abnormality, maybe even a cyst in the brain. But usually cysts don't cause harm. Usually cysts are pretty innocuous in the body. We asked for a contrast study, and instead of getting it in Russia, he flew into the United States. And came in, flew in. I
Did
don't
he
know
find
what.
you over in Russia and decided to make the trip? Or?
Yes, that's right.
Okay.
He heard about us through a friend that we treated before successfully.
Okay.
Came in this week. We did a contrast scan, and he had entangled blood vessels. I'll leave it like that, a disease with abnormal blood vessels in the brain that are prone to bleed.
Okay.
And we got the new scan, compared it to the 2008 scan, and actually this cystic lesion, this mass, is enlarged a lot. This last few months, he's had further episodes where he's had seizures and even loss of consciousness. So he desperately wants to get treated. We spoke to him about all the options, everything from no treatment to surgery to radiosurgery. No options means you just do what you're doing, which is nothing. Right. Surgery means invasion of the brain, and this is the dominant hemisphere, so there's a significant chance of harming him.
Right, I would assume there's more risk.
Yeah,
that
so
type of,
he's 30
procedure.
years old. He could have stroke-like syndrome after the surgery, or even death. There's about a 1% death rate with open
he's
surgery.
A young man. Yeah.
He's got a business in St. Petersburg. He's a contractor, so he's making houses, and he's doing pretty well, it seems like, in his business. So he chose to proceed with fractionated stereotactic radiosurgery with us. We were the first ones, and people kind of lose track of it. I don't lose track of it, but we were the first ones in New York to perform radiosurgery. Radiosurgery means we send in beams that are very precise to hit abnormalities. And now in this case, it's not cancer. It's not even a tumor. It's entangled blood vessels that are prone to bleed. And if they bleed enough, they can actually cause a stroke or even death.
Okay, wow.
So studies have shown that the patients who have radiosurgery do much better, less episodes of bleeding, less episodes of neurologic impairment. So he had his first treatment on Thursday and is doing great. He's going to have 5 treatments total. So 1 down, 4 to go, and then he heads back to St. Petersburg, where it's getting pretty nippy.
I would imagine so.
Yeah, winter's come. I've been in Russia twice this past year, and the winter is pretty harsh.
I can only imagine. We've been very fortunate this year.
Right. Well, New York is like paradise compared to Moscow in the winter. I was there even beginning of spring at the end of March.
Okay.
And the Moscow River was iced over.
Right.
I have photographs
like a rock.
of Moscow from high-rise buildings, and the whole city is like white and gray from snow and that
brutal weather.
Yeah. So anyway, we wish him well, and I think he's going to do great.
Good.
We had another patient who I want to talk about on the other end of the spectrum, a young girl who came in, 10 years old, with sarcoma. Now, sarcoma is a kind of cancer of the connective tissues, so muscles, bones, connective tissues. Normally, we think about cancers like breast and colon and lung. Those are the organs, and the surfaces or the tissues of those organs can cause cancer, but rarely the connective tissue, the bone. Everything you think about is like the foundation of a human being, the bones, the muscles, the connections, can also cause cancer, and often do in children. So this girl had a mass in her thigh, and it grew to quite a large size, and she eventually had surgery on the mass, even though she had metastasis at the time. Now, metastasis means that the cancer has already spread.
Right.
So it spread to the lung in this girl. She had chemotherapy before the surgery. Then she had extensive surgery. Her family said that most of her hamstring muscles, 80 or 90%, were removed to get rid of this tumor. And then she had chemoradiation. Afterwards, the mass has stayed away. So it means that the surgery and the radiation worked. How do we know the chemo didn't work? Well, the cancer in the lungs progressed within a short period of time, within 2 months. So it progressed. She had some surgery for metastasis on the lung to prove that it was cancer. She had surgery on the liver to prove to remove the liver cancer. And the family was very reluctant to have a PET scan because they didn't want the child to have unnecessary radiation, which I agree. I try to avoid radiation in myself and my patients.
Sure.
So she was treated elsewhere with a machine called tomotherapy. Tomotherapy is a machine that gives radiation, but it gives it only in one plane. So if you imagine like a donut, all the radiation comes from the donut. So it doesn't come from below the tumor or above the tumor at angles, only from that one plane. So there can be harm to the adjacent tissues, number one. Number two, the family was very concerned about excessive radiation, but with tomotherapy, there's a CAT scan that's done every day to set up the patient.
Sure.
So this little girl had 28 treatments, and she had at least 28 CAT scans, and some days she had 2. So she had somewhere between 28 and 56 CAT scans for this treatment. The family, I wanted to get a PET scan. The family was a little bit reluctant, and finally I said, look, with a PET scan, we know exactly what we're dealing with, and then you can make a better decision than if you just have a CAT scan.
Right.
So the family came with the idea that there was only one lesion in the lung and one lesion in the liver. And in fact, when we got the PET scan, it showed that there were 2 lesions in the lung and 2 in the liver, and one of them in the liver was the site where the surgeon tried to remove it. Mm-hmm. And in fact, we spoke about this when we met, that often surgery spreads the cancer cells. And sometimes there's stories out there that surgery can spread cancer cells. Well, in this case, also prostate. This case, it's documented. She had surgery. Now she has a PET scan, and there's tumor recurrence right where the surgeon was.
Right.
So the beautiful thing about radiosurgery is it's all non-invasive. We don't have to touch it. It's not on our fingers. We're not spreading it. We're just hitting it, and that's why the success rate in our hands is so high.
Right.
Our success rate is 90% for sarcomas, and sarcomas used to be considered radio-resistant.
Right.
So in the old days, and still many people unfortunately believe it, that radiation doesn't work. In fact, radiosurgery works very well for sarcomas. So we're hopeful for this beautiful girl that she goes through the treatment successfully.
Of course.
Most likely she will.
Good.
It's non-invasive treatment. People come in, get a treatment, and go home. A treatment takes usually 15, 20 minutes. And we certainly wish her the best.
That's right, of course.
Dr. Eisen's on the line. Dr. Eisen is a Spanish-speaking doctor who takes care of the Spanish community. And last week he was all over New York giving lectures in Spanish to doctors and to patients. So welcome, Dr. Eisen. As we say in New York, buenos dias.
Buenos dias.
Morning,
Now,
Dr.
I
Eisen.
understand that you've been elected to the New York or National Hispanic Medical Association.
Yes, that's something that it's a great honor because it will give me the opportunity to bring to the board a whole new way of related with not just only with the patients, but also with all the physicians.
What's the name of the organization, Dr. Eisen?
This is the Spanish New York State Spanish Medical Association.
Is there a name in Spanish of it?
This is America's Asociación Español New York City or New York Association. I don't remember exactly.
All right. Well, congratulations on your appointment, and I hope it serves you well and that you
Well,
can provide.
actually, it was very good because after my presentation of radiosurgery, the physicians actually called me. In fact, I saw a very interesting case, actually with you, a patient with a lesion on the liver. And not only the patient came, but it came a physician with the patient because he was very interested in learning more about the way that we are approaching lesions in the liver. And actually, they were very surprised that in a very quick situation, we were able to not only just see the patient and do the examinations, but also we got the PET-CT the same day and all the different labs.
Right, so we did everything. So actually, we have what's called the Urgent Cancer Consultant.
Right.
And for patients who need an urgent cancer consultation, we promise you we will see you within one business day. So you're not going to linger for weeks and months to get an appointment. This patient called us. They came in. We got them scanned. We got the blood test. And in 24 hours, we got all the answers for them. And in fact, this gentleman was about 80 years old. He had a large mass in the liver. His primary physician found it. They did other tests which were not conclusive. We got a great test within